Hi, I'm Dr. Savan Hilo, a urologist at the Mayo Clinic in Rochester, Minnesota. I specialize in male infertility and sexual medicine. This video is on understanding azoospermia, what it means, and what you can do. Non-obstructive azoospermia is a medical term we use to describe when sperm aren't found in the semen because the testicles are not making sperm properly. This is different than a blockage, which causes obstructive azoospermia. In healthy men, the testicles make sperm, which then travels through a series of tubes to mix with other fluids to form semen. In non-obstructive azoospermia, the testicles might not be making sperm properly. This can happen for a number of reasons, including genetic conditions, hormone problems, or past injuries. Even though there aren't sperm in the semen, some men with non-obstructive azoospermia can still have sperm in their testicles. We can perform a surgery called microdissection testicular sperm extraction, or microtessie for short, which can help some men have children with the help of in vitro fertilization. To diagnose non-obstructive azoospermia, we use several tests to understand why there aren't sperm in a man's semen. First, we'll ask you about your medical history and perform a physical exam. We'll ask a number of questions about past health problems or injuries that could affect sperm production. The physical exam is a very important part of your workup. A small testicle indicates that there's a 90% chance that you have a sperm production problem instead of a blockage, which isn't allowing the sperm to get past. Next, we'll ask you to do a semen analysis. This is a test where a man provides a sample of his semen and the lab checks to see if there are any sperm in it. If there are no sperm, it's called azoospermia. Because there can be a lot of variability between labs, we'll ask that you do at least one semen analysis here at Mayo Clinic to confirm that no sperm are present before proceeding with any invasive treatments. To find out if the problem is in the testicles where sperm is made, we'll check two hormones, testosterone and follicle stimulating hormone, or FSH for short. Hormones control sperm production, and problems with hormones could be a reason for azoospermia. If your testosterone is low, we may recommend treatment before repeating a semen analysis to see if your sperm counts improve. If your follicle stimulating hormone is high, this is also predictive that there's a 90% chance you have a sperm production problem or non-obstructive azoospermia instead of a blockage that isn't allowing the sperm to get out. In most cases, a biopsy of the testicle is not recommended because we can make the diagnosis of non-obstructive azoospermia based on your physical exam and hormone labs alone. Doing a biopsy is unlikely to change what we would recommend. It's also an additional financial cost and exposes you to potential complications and can increase the risk of scar tissue if you do choose to proceed with the surgery called microdissection testicular sperm extraction, or microtessie for short, which is the recommended treatment for this condition. Genetic testing for non-obstructive azoospermia helps doctors understand if there's a genetic reason why a man isn't producing sperm. Sometimes problems with the genes can prevent the testicles from making sperm. In genetic testing, the doctor would take a small sample of the man's blood or a cheek swab. This sample is then sent to a lab where it's tested to look for changes or mutations in the man's DNA that could be causing the problem. For example, some men with non-obstructive azoospermia might be missing part of a gene that's important for sperm production. One common genetic cause is a change in the Y chromosome, or male chromosome, which can affect sperm production. At Mayo Clinic, we'll refer you to meet with one of our clinical genomic team members. They will get a thorough family history and explain what the genetic testing will look like. We offer a custom gene panel that includes over 300 infertility-related genes that is more affordable and more comprehensive than the standard testing that most other places will provide. Using this test, 20% of the time, we can tell you why you have a sperm production problem. And in some cases, it may influence whether we recommend that you proceed with a microtessie procedure. Knowing if there's a genetic cause can also help us understand the problem better and help guide treatment options. It can also help the man understand if there's a risk of passing on this condition to his children. Thank you so much for listening to this video. I'm Dr. Savan Hilo, and I look forward to meeting with you.